Awesome. Hi, Feminista Jones. I'm so excited to be with you this morning at God's appointed time of 11 a.m. I love that your head wrap. First and foremost, I have to start with showing some black girl, black woman love.
Thank you. Thank you. I'm so happy to be here. I'm just making sure that I can share this link with my good people so they can join in.
Yes,
And it just
please.
populated.
Let's do
Um,
that. I know we're waiting as
yeah.
more people join us on Facebook land. Welcome,
Mhm.
welcome everyone. I'll also make sure I am also sharing this
Okay.
thing out. Everyone watching, please
Yes.
do it as well. Share the good news with your crew and your community. We're going to be talking about National Women and Girls HIV/AIDS Awareness Day and some really important information that everyone in your community should know. So please share the link, share it around, and make sure as many people as possible are plugged in. Awesome. Good. I see some more folks joining. Welcome, welcome. Please continue to share. Keep sharing with folks in your community. I know we're on Facebook, but you can also share the link on Twitter. Put it in your bio on Instagram. All of the above. And we are going to get started in just a moment. Awesome. Feel free to comment and ask any questions that you all have. We are definitely going to do our best to respond to any that come in. Awesome. So, for those of you who are new to the NBJC family, the National Black Justice Coalition was founded in 2003 and is a federal civil rights public policy organization. We do work focused on health and wellness, tech justice, education and workforce development, and civil and human rights. We know that in order to thrive and to be happy, healthy, and whole, we have to ensure that we have our rights protected and have access to education, financial resources, and so many other necessities to be able to be self sufficient in a society that too often doesn't recognize the brilliance and beauty that we are. We are thrilled and excited to have Feminista Jones with us, who is a
Thank you so much.
trailblazer and
Oh, I'm so
history
honored.
maker.
Oh gosh. Oh gosh. I'm so honored to be here. Like I feel like whenever David, sends out a call, I'm like, I'll be there, whatever you guys need, because I mean the organization is doing such amazing work and I'm happy to have, been able to support for the past few years. So, I'm really honored at this opportunity to talk about this super, super important issue in our communities.
Thank you. Thank you very much. And welcome to all of you who are tuning in. Today is National Women and Girls HIV/AIDS Awareness Day, and it's a day to support women and girls affected by HIV and AIDS, to shine a light on the virus's impact, to reduce stigma so that we all can thrive, and ensure that folks have access to important healthcare information that can increase the quality of life for those living with HIV and AIDS. Often the virus gets painted as solely a gay disease. In the early days, it was very much painted as a white gay disease. But what we know
Mm-hmm.
now is that the face of the disease has grown much more chocolate and a lot
Mm-hmm.
browner and blacker. And one
Mm-hmm.
of the things that folks seldom appreciate and acknowledge is the disproportionate impact on Black women
Mm-hmm.
and our girls. Black cisgender and transgender women and girls make up less than 15% of the female population, but we've accounted for 57% of the new HIV diagnosis amongst women in the United States. That is why it is so incredibly important for us to have conversations about HIV and AIDS that center and don't exclude Black women and girls like the ones that we're having today. We're so thrilled to be joined again by author and activist Feminista Jones. Definitely check the book on her left, Reclaiming Our Space. You gotta buy it.
So people continue to show love for this book, and I'm so honored by that. Like, they're still teaching it in colleges and universities and high schools even. So I really, really, really love that a book about Black women is getting all that love still. And it came out 3 years ago.
Yes.
So it's been that long. Yeah. So I'm gonna write another one.
Yes, do it. We need it. Yeah. We need it. Yes. I mean, it's important, especially on social media, which is why we're having this conversation via Facebook Live, that we're getting information out. And we know you are part of the trailblazers in Black Twitter, ensuring, leveraging Twitter to get out the stories and issues that the mainstream media wasn't covering. And too often, the only reason it was covered was because of Black women and others in Black Twitter who raised the issue. So thank you for not only doing that and being a blueprint, but then writing a book to be like, look, it ain't just about me. We all can do this. We can all raise our voices, and here is how. So thank you so much, and thank you for joining me in this conversation. So, as I shared earlier, there is a disproportionate rate, particularly around young Black women. The rate of new infections among Black girls and women aged 13 to 24 is six times higher than that of young Hispanic women. And hold on, I used to say, hold your mule, hold on, 20 times that of young white women, 20 times. How do we create spaces where Black girls and young adults can freely and comfortably talk about their sexual health and HIV?
I hope that people pause at the staggering, information that you just get. Like, the numbers are absolutely ridiculous, and so much of it is about how we engage each other in our communities, right? And there's the effects of colonialism and white supremacy on even just the way we think and talk about things is where we have to start, right? And we have to bring race and culture and ethnicity and those things into this conversation. We create those spaces first with intergenerational work, right? I am in my 40s. I'll be 43 in a few weeks. And there is a disconnect, and we have to work on it. Folks in my generation, Gen X, those older, those younger, we have to do more intergenerational work, because the knowledge sharing that needs to happen between all of us is super, super important, right? We need the moms and the aunties and the sisters and the grandmas and all the folks coming together to have these important conversations. And that's where we feel safest, right? When you think about our cultural traditions, we feel safest sitting in between someone's knees, getting our hair braided, or, being at that family barbecue. That's where we feel safest. So we have to make sure that continues, right? We have to make sure that we have the information to have these conversations. So you can't create a safe space that is uninformed, right? Because then you're actually putting our young people at risk by having conversations that are filled with misinformation, right? So we got to make sure that we are educating ourselves before we're talking to anyone else. I have a 15-year-old son, and he and I talk openly about sex and sexuality and all these things, and have, because I believe in sex-positive parenting. But I got to make sure I'm up to date on these kinds of statistics and this kind of information. I think that we need to create spaces where it's just, girls. It's just, just us girls kind of thing. Because sometimes when we have these broader community conversations, we get into the accusations and the finger pointings and the denials, and it gets kind of negative and heated. And we need to make sure that we're creating spaces where people feel like they can talk. And the final thing that I will add is that I think creating safe spaces also means inviting professionals to come in. So I'm a retired social worker, and I've done therapy work, for many, many, many years. And I think it's important to bring folks like me into those conversations to help facilitate things, to help make sure that when these emotionally charged conversations happen, that there's someone there that can help, kind of have their finger on the pulse and keep the temperature where it needs to be and offer support. I mean, there's a lot of grief that comes out of these conversations, right? So we need grief counseling. So I think that those are some of the ways that we can create the safest spaces.
Whew, you just hit on so many gems. First, got to show love to you as a social worker. My wife is a social worker. And
Yes.
it's some hard work, too
Yes.
often underpaid and under-resourced. I love what you lifted up around grief. So much about sexual health follows in this spectrum of joy, but also grief, depending on how one's sexual history has begun. And we know, unfortunately, for Black women and girls, 25% or more of us have endured sexual trauma at an early age, myself included. And so often when that happens, you're not introduced into the world in a way, the sexual world, so to speak, in a healthy and informed way. And so there's so much about that grief piece that is really important to name and to lift up, because you have to clear that in order to truly be able to find the joy. That's also
I want to add, because I think this is something that I don't see a lot of conversations about, the grief around, our trans sisters and trans brothers, that they deal with the rejection of family, but also the family dealing with the grief of what they perceive to be loss, right? Because we are so ingrained in this heteronormative, cisnormative society that there are family members that are processing, I lost my son, I lost my daughter, and they are projecting that onto our family that is just trying to live honestly and live in their truth. And so when we talk about sexuality, we also talk about sexual identity and kind of the grief cycle that can happen in there, and how do we navigate that to keep families connected or to support people that are just trying to live in truth. And so we have so many of our trans folks who have lost their families. And have been disconnected to their families just by living truth. So, and younger folks who need us the most, right? Again, I think about, my son at 15, if he were to tell me that he's experiencing X, Y, and Z, I'm just like, I'm loving you. I don't care what's happening.
Right.
I'm loving you because I see what has happened to so many others, so creating safe spaces in your families, in the house, to even know that you remain loved just as you are, whether you test positive, whether you are trans, whether you come out as, or invite people in as a queer person, knowing that your house is safe is super important.
Yes. And sometimes that requires parents to seek therapy and support away from their child. And so often the processing of that grief, of loss, of whatever they've kind of put into their child's identity that's really not of their child, ends up being conversations between the parent and that child, and it's not the child's responsibility to carry that grief. Yeah.
And so I just wanted to bring that in because it's something that's actually been on my mind recently about, like, there's a bit of work that needs to happen there, particularly within our community, because our families are already so disjointed and have been torn apart. The last thing we need is to add another layer of family disconnect when we can actually prevent it by offering that kind of love and support.
That's right. I often think about some of, shame is accurate, is not as strong of a word for everybody's experience. But growing up in the Black church, especially, sometimes, talking about sex and sexuality, even though the moment we leave church, it's on the radio, you hear songs blasted talking about, different sexual acts. When you're in the building, there's such a purity culture kind of that's ingrained, that there's so many conversations around safe sex that just never happen, because the push is, you shouldn't be having sex, even though you're surrounded by a culture where sex is happening and being talked about everywhere else around you, except for that hour and a half. I grew up Baptist, so sometimes 4-5 hours, in church, or, in mosque, synagogue, temple, etc. And so, I just wanted to name that part of what we have to do is, to be honest, sex is talked about in the Bible in both spiritual settings as well in our educational settings, that we have comprehensive conversations around positive sexuality. And it has to start with our girls, because I remember me and my friends, we was in elementary school talking about this stuff. We didn't really know,
because we become sexual objects as children. So there's a consciousness of that we, I think, seek out. We have this curiosity around sex because we are sexualized so young, and we're not even given an opportunity to be children before we have become sexual objects. And so we definitely want to know, why did that man say that to me? Why did that person, touch me in that way? Why did they look at me like that? I need to understand what that is. So I think that's a lot of it.
Whew. Look, that's a part 2 conversation. We need to dig in. That's a whole day. That's a conference. That's a multi-day symposium. That's a book. Yes, that is a book.
I'm not writing it, but
somebody need to write it. If there's a book out there addressing it, y'all, throw that in the comments too. Because, no, that's so important. I have a 4-year-old, and I think about that all the time. She does these little dance moves and tries to twerk. And I'm like, where did she pick that up from? I can't even twerk. So I don't even know where she saw it somewhere scrolling on YouTube, And I want her to be joyful, and I want her to be happy, and I want her to dance. And I don't want her to feel any shame about her body. And there's also always, fear as a parent about how people sexualize our children. So one question that I want to pose is, there's so many medical advances that have taken place, and often you see a lot of the marketing focused on men and not as much focused on women. How can we make sure that essential information regarding scientific and medical advancements like PEP and PrEP reaches Black women and girls who are HIV positive or vulnerable to HIV transmission?
I was just thinking about this the other day. I watched a PrEP commercial, and it says this has not been tested on, cisgender women. I was like, oh, well, that doesn't make people feel confident.
Yeah.
The truth. They're like, but okay, so where is the research and the information and the studies that we can get out? Because everybody's like, I'm gonna do my own research, and no, how do we make sure that the research is being done, the studies are being done, that specific demographics are actually being engaged in this research and development process, so that when it is time to talk to them about, because we're talking medicine, we're talking medical interventions, and our folks get a little, we're a little wary of what the medical community is trying to do to us, like, not unjustified, right? And we can take it to the extreme, but I think the more information that we have about the impact on the bodies and the lives of Black women and girls, the better off we are. We have so much stigma to fight against. We have so much. I think about this conversation so much when I used to work at a syringe exchange program. I was doing research with a local hospital, kind of on people that were HIV positive, how they accessed social services and things like that. And the one consistent thing about every Black woman that I, worked with or studied or interviewed or whatever, is that she got it from her boyfriend. She got it from her husband. She got it from, a heterosexual man, or who she believed to be a heterosexual man. And it was not what Oprah was telling us.
Yes.
In the 90s, right?
That's right.
It wasn't.
That's right.
It was that. And so the stigma that I can't get this from this guy because he's not this particular way is such nonsense, right? You don't, and the drug use, within our communities, it is what it is, but we don't talk about that either. It's like, some people don't think
party and play, P&P.
It's
unprotected sex and drug storage at the same time.
And they don't think that we're like shooting up or anything like that. And I'm like, oh, okay. Like, I don't know how we got to think that we don't do that, but we absolutely do. And so again, a lot of it is about getting the right information out, destigmatizing things, and making sure that when we are presenting to people saying, hey, you can use this, that we also have the information to back it up and says, this is what we know about the effects on people like you. And I think the more we do that, the more we push for that, the better off we are. Black doctors, I'm looking at y'all. Let's get it going.
Yes, let's get it going. So I want to say two things about some of the points you raised. One, I want to make sure folks know that Truvada is a PrEP medication that has been tested on women. And I want to make sure that folks know that at least for that medication, it's not true for all of them, but it is true for that one. You know, that is one that there have been positive clinical trials, and we encourage folks to take it. I like to talk to people that it's like taking birth control. If you're sexually active, you take birth control to prevent, you know, pregnancies. Pop that PrEP to prevent, you know, HIV positive status.
And they have one that people can take every other month or something like that.
Yeah, there's new.
Yeah, that's what I was just, and I think that was the one that I heard where they're like, it hasn't been tested yet but obviously they're getting there, right? Because they want this to be accessible. Don't quote me, because my memory be like whatever. But I know, I was like, oh wow, I was like, because the whole thing was I don't have to worry about this every day, and I'm like, this is great, like something that people could take every other month. And I was like, this is what we need to get out there. This is the information we need to get out there.
That's a win.
And making sure that people are, like you said, not confusing Truvada with this, you know, and stuff like that. So yeah, that's dope.
Anytime we don't have to pop a pill every day, I'm just like, sign me up.
Every day.
Me too.
I be looking like, okay, this one, I got one sitting right here. When we're done, then I got to take.
That's right.
That's what happens when you get on the other side of 40.
Oh my God, man, I haven't even made it to 40, and my pill section is like that. I'm just like, Lord, please, let there be a calm.
The scientific innovations are amazing, and I think what remains important is that, and in this whole conversation, what remains important is that we are making sure that we are centered in the science. Because for too long, everything related to sex, sexuality, things like that has left us out of the conversation. We have been left out of the research. They are not coming to us to work with us. So we have to just keep pushing and making sure that we are represented in these studies the same way white cisgender men have always been represented in sex and sexuality studies.
That's right. And that's a big part of NBJC's policy advocacy. When we meet with the Department of HHS, when we meet with members of Congress who really do have a focus on healthcare and are on healthcare committees, when we've met with White House staff, whether it's been from the Gender Policy Council, the Office of Public Engagement, the Domestic Policy Council, we've really been focusing on data collection and the reporting to ensure that sexual orientation and gender identity are collected for everyone. So not just men having sex with men, but also in the reporting of the data, that there's easy ways for advocates and people who are living with these diseases or susceptible to these diseases, different diseases, so not just HIV, AIDS, a number of them, reproductive health disorders like PCOS and fibromyalgia, uterine cancers, etc. Too often don't provide that back end data that allows us to see where there are big disparities, where we can see, oh, wow, Black trans women are impacted in this way. Black cisgender women are impacted in this way. You know, this particular age group of Black women are dramatically impacted. And it requires, one, that SOGI, sexual orientation, gender identity questions are asked all the time, even if it's an option. Because I know some surveys, you know, there are people who fear being, you know, publicly outed or being forced to invite others in. You know, so whether it's optional or not, asking the question is important because we can't connect those dots without it. And so that's definitely been a central part of our tech and data justice pillar.
Absolutely. Because when they want to do the doomsday stuff, they include our statistics, right? Because when you extract us from the data, it ain't so bad, right? And that's across the board, especially if you think about that in like feminist work, right? And women's work, it's like we talk about the wage gap. Well, the reason why the number is that because of us. If you take us out of it, y'all are doing all right.
Yeah.
So
Preach on it.
If you want to use us for the doomsday stuff, you have to include us proactively for the positive work.
That's right. Because that has a big impact on screenings. There are women who would never even think to ask their doctor for an HIV test.
Oh, but when you do, and they tell you you don't need it.
Yes, that part.
Okay, so that is another thing. And so advocacy, I was going to mention this, but let's talk about it now. Advocacy, self-advocacy, but also like community advocacy to make sure that we are encouraging our girls, especially our younger girls, to have their doctors do these tests. Or, you know, our younger women, they are going and the doctors are saying, oh, you don't need that, you know, because you're only having sex with one person. But it's like, well, I don't know who that person is having sex with, right? I want to be tested just for my own knowledge. But some doctors will actively discourage people from getting tested for certain things. And even with like things like HSV1, HSV2, you know, most of us have HSV1, but HSV2, people don't even know that that's not a part of your STD, you know, testing and things like that. And we don't want to stigmatize people, you know, that may have whatever sexually transmitted disease or virus or, you know, infection, but we want people to know. That's so because you can make informed decisions, informed actions with your life, with your partners, things like that. But when you're going to doctors and sexism comes in and heteronormativity comes in and cisnormativity comes in and they're discouraging you from getting these tests.
You got to keep pushing.
Which I only really became aware of in the last couple of years, that there are doctors actively discouraging people from getting tested for certain things. Then we have a problem. And now I'm wondering, are you only doing it with us?
Right. That's a whole...
Is it only with Black folks? Is it only with women? Like, are white men getting the full panels without question? Like, what is happening?
Yeah.
I'm really interested in that because it's like, you don't want us to know?
Well, because if we don't catch it early, that's when it gets worse. It's harder to treat. It's harder to save your life. You know, it's these early times when it's important.
I've lived in America for almost 43 years. I know a little something about a little something.
That's right. You know? And happy early birthday. But yeah, it's true. It's true. If they try to discourage you, push through anyway. Say, actually, my insurance covers it, or actually, I'm fine with covering it, or whoever, whatever. No matter what, get it done.
Make sure you have them document that they said that they declined or that they told you not to. You know, all those kinds of things that people have been talking about on social media, that folks are saying, you know, I read this on a tweet that I should have my doctor write down that they wouldn't do this test, and my doctor decided to do the test then. And, you know, it's stuff like that's how we can use social media to empower each other towards self-advocacy around these issues, is getting it out there. Demand a test.
Yeah, that's a hashtag, y'all. Demand a test for everything. Know your family history too, you know.
Know your family history.
It's big.
And demand a test.
Every 3 to 6 months if you're sexually active.
Yes. Every 3 months for me because I'm polyamorous.
Yes.
So, you know.
Do it. I love it. So we kind of just touched on this a little bit, but I want to still ask it just in case there's anything else that you might want to share. But heterosexual contact accounted for 91% of new HIV diagnosis among Black cisgender women. So, you know, as you said, flies in the face of stereotypes regarding how Black women, you know, are become HIV positive. Unfortunately, most of this data does not account for bisexual and pansexual women, you know, or probably polyamorous women, to the point you just raised. What more can the federal government do to support Black women and girls living with HIV?
The answer is money, but let's break it down, right? Because one thing we know, so we go back to George W. Bush, right? My ex-husband at the time was an adolescent health educator, and he was in a program, you know, running a program where they went into the schools and they were educating young people as young as kindergarten about things like HIV and things, you know, health things like that. And it was age appropriate, but as they would go along, they would learn about these things. George W. Bush cut so much, and that was called prevention education. Prevention education was cut up, sliced and diced, and if you were not doing abstinence-only education, you lost so much money during this time. And we're talking, this is the early 2000s, you know, early mid-2000s. We are seeing the effects of that like 20 years later, right? So all these people that were in school at that time were not getting the sexual health education that they needed because of these cuts. Had that funding remained, had we still been able to keep that education going, we may have seen differences. We know that when prevention education happens, that the trends are that people, there's lower rates of teen pregnancy, lower transmission of sexually transmitted diseases and infections. Everything just goes down because the young people are getting the education that they need. But when that stuff is cut, and then you have people that come in, so-called liberal people, but they don't reinstate the funding, right? They don't make it a priority to make sure that this stuff is getting back. Or even now, as we see, people are actively fighting and winning against talking about sex and sexuality and gender identity and anything in the schools. This don't say gay thing that's happening, but it's not just Florida. People like,
it's happening in
Florida, Texas.
everywhere.
I'm like, there are so many of these laws in the pipelines in so many states across the nation. It is terrifying.
I was on a policy call yesterday, and almost all the 50 states were called out. Calling for an hour, we're going through all the states.
And they're flowing with their own momentum, which is what we should always be doing, right? We should be building momentum and going with that to counter these things and to be in these policy spaces and development. But the federal government has to allot more money towards prevention education and get it back into our schools, get it back into our communities, give more grants for people that are experts on this. If you want to create community school programs, whatever, community programs that are reaching youth and adults, there needs to be federal funding to support those efforts, because you got the people out there ready to go, but they don't have the money. People can't keep crowdfunding all the time. They can't rely on the GoFundMes. But the federal government has to put the money back in. And then I think that when they are supporting stuff through, whether it's the CDC or what have you, I also think, just even down to the posters that they're showing and the flyers and how the information is disseminated. The CDC right now, there's a lot of people are not really trusting the CDC because of how things were going with COVID or whatever. But you have to get back to a place where people can trust institutions of the federal government to be able to disseminate information, accurate information that folks can actually use to try to bring about change.
That's right. We actually partner with the CDC with our HIV/AIDS work, and one of the things that they're really eager to do, and we are very eager to do in partnership with them, is increasing the representation of Black women and girls, especially transgender women who are both binary and non-binary. Not just folks who may live stealth lives or might be passable, but folks who, are more genderqueer as well, in the images and assets that accompany some of their campaigns. And next month's Awareness Days includes National Transgender Testing Day. And so we're excited to see how some of that shapes up with that Awareness Day. Black transgender women made up 49% of new HIV diagnoses among transgender people in 2018. How can we ensure intersectionality is being taken into account in conversations about HIV/AIDS, especially when it comes to Black trans women?
Again, what I was saying earlier about, our community conversations and really looking at the negative impact of colonialism and white supremacy, and how it began to shape our consciousness of how we even think about gender and sex and sexuality and things like that. Like, Black trans women have always existed, have always been, and I think that, trans people just across every culture have always existed in some way, shape, or form. And through colonization, we've been disconnected from that. We got lost from that, and from honoring these people in our community as just welcomed part of our communities to now being pariahs. And I hate that. I hate that. And I think that there's a lot of education that needs to happen around that. I teach at Temple the African-American LGBTQ experience, and I talk about this a lot, especially how it intersects with Afrocentricity. It's like, we have to get back to this place of honoring our cultural history that has always included people of a trans identity, right? And so that we start there. And then we bring it so that we are not afraid to talk about what is happening to our fellow human beings, right? Because when we make it about the intersections of these identities, right? I mean, I think it's important when we're talking about, specific things, but I think that when we kind of go back to the fact that these are human beings, which is very hard for us these days, and I've really been thinking about that a lot. So we are human beings.
First and foremost.
And fundamentally, as a human being, we have human rights that we deserve. The right to be treated with dignity, the right to, to be respected, to have our humanity honored, right? To have access to the same resources that everyone else has. And that's where we start. And within our community, we have to combat our transphobia, our cis normativity. We have to confront that and remember that we are all human beings. And if we're about Black liberation, we're about African liberation, then it has to be about all African people across the diaspora, all of us. It's all of us or none of us.
That's right.
And so Black trans women get included in that because when we think about those intersections, we're thinking about so-called Blackness, so-called womanhood, so-called trans identity, so-called this, and all these things. They're moving further and further and further away from this white supremacist thing. So if anybody can manage and deal, and if you're able to survive in this world, the people that we need to be listening to and caring for are the ones who are the furthest away from this, this white cisgender heterosexual male thing. Right. And so that's where our Black trans sisters come in. And it's like, we have to make sure that we're listening to their stories. We have to make sure that we are amplifying their stories and centering them in these conversations and making sure that they're the ones who are leading those, conversations. Like when you have that day, we want to see the Black trans women out there being able to speak their truths and to come in. The rest of us have work to do. When we talk about like white people have white people work to do, we have work to do as well. Those of us that are cisgender, right? We have work to do. I identify as a pansexual woman, but I will say to our heterosexual folks in the community, you got heterosexual work to do. We all have this work to do. And the problem is that many of us don't think that we have to because we're Black and all we're really focusing on is the Black. And I'm like, nah, man, we have to dig deeper because we can't fight against white supremacy if we are divided as a people.
That's right.
And if we're killing our own people. And if we're, having these fights and divisions within our own people, we will not be strong to fight against white supremacy, which is the cause of all of this.
Yes.
Right. So that's how I think about it. I know it's like a little bit roundabout, but honestly, I think that like we could talk about these little bandage solutions, but if we don't get to the core issues here, if we don't get to the roots and dig up those rotten roots and cut it off, then we're not going to be able to do anything.
Ooh, that's a word. More than lovingly by the trans community was April last year. We had been pushing some of our policy priorities to end violence against Black trans women, and the executive director of Black Trans Women Incorporated, lovingly sent me a response to the priorities and said, I think it's important that we not be separated from our Black cisgender sisters when we talk about ending violence. Because when you look at the rates of hate crimes and domestic violence against Black women, whether it's cisgender or transgender, it's a crisis. And so we can't decouple ourselves from each other in this fight. There might be nuanced differences, but the call to action has to be united. And, I was just like, yep, you right. And I've incorporated that moving forward.
To be able to have those conversations is where we go forward, and people have to check their egos. People have to humble themselves. People have to be open to correction, open to learning. I have been corrected over the years. Like I have had a lot of learning to do. I will never sit here and say I came out of the womb perfectly knowing all these multisyllabic words and all these things. No. I grew up in the same situations that a lot of folks have. And I've just been able to access resources and opportunities and people who have helped me grow and helped me learn. So we all have to remember that we have to remain open to learning, open to growing, open to working together, and open to the fact that people have the right to self-determination. So I can't tell you how, you should be doing X, Y, and Z. You got to be telling me what works best for you. And I'm here to support you in that. And a lot of times, folks of us that are activists or that get in leadership positions struggle to do that. Struggle to be like, well, I need to listen to this person who has no major following or no name or anything like that. They don't want to hear it. I'm like, we've lost ourselves in a lot of these ways. So a lot of people getting high off their own supply. It's not really a good look. That's not how community works. That's not how community works. We show up together, we show up on even footing, and we look out for everybody in the circle. That's it.
Yes.
Bottom line.
I love that. Well, this is our very last question. I really enjoyed sharing space with you today and having this
Me too.
conversation.
It's been great.
What is the most important thing that needs to change about HIV care for women? How can medical professionals better care for and support Black women and girls living with HIV? I know we've hit on some of this in our conversation, but if there's any additional
Yeah,
thoughts.
I definitely quite simply, it's as the point that you just made that the trans sister told you is that it's about the healthcare for Black women in general, right? That the fact that institutionalized racism and sexism and misogynoir remains a thing that affects all of us because the medical community can't seem to divest of its, centuries of anti-blackness and anti-womanness that we continue to struggle, right? So whether it is the mortality rate, the maternal mortality rate, whether it is, related to HIV transmission, whether it's related to, uterine issues around like talking about PCOS and fibroids and all these things like that, like just even down to pain, we have to see a shift in how Black women are even being taught in medical schools, right? How we are being studied, how are we being centered in these things? Are we offshoots? Are we footnotes? Are we actually being centered in that? And so I think that when it comes to HIV care for women, it's really a holistic approach to actually treating women better, actually treating Black women better, within the medical community and making sure that we have access to information. The other thing that I just want to touch on that we didn't get as much into is the class divide, because we sit on social media. You and I are having a conversation right now because we have this wealth of knowledge, both of us. We're coming from these really informed places, and then we can go on social media and we can share things, but there are people that are not on Twitter, they're not on Facebook, they're not on Instagram, they are not able to access this information that we share and put out there. They don't necessarily know what we're talking about. I can say CDC, they may not even know what that stands for. So we have to remember that, and we have to remember that we have to go into our communities and we have to be part of the communities, and it can't just be I did this online or whatever, and I completely forgot about all the people on the other side of the digital divide, all the people who cannot read, all the people who do not speak English as a first language, right? Like, we have millions of Black folks for whom English is not their first language. So we have to make sure that we're doing things and making them accessible, and that we are not kind of taking. I'm not saying that you all do this.
Yeah, no, this is good.
Just in general, that we tend to take this approach that we assume that everybody's kind of where we are or whatever. When you got people that are starving and don't know where their next meal is coming from, they're not necessarily trying to hear what you got to say about going to get tested. So how do we make sure that we are providing holistic support to folks that happen to be struggling and living in these really depressed and disenfranchised neighborhoods, right? I don't like to say living in poverty anymore because it's not their fault. It's not their creation. It's poverty is something that is done to people. It's done to communities intentionally. So I like to change the language about that. But we can't. So many of us are so afraid to go into these communities because of our own classist nonsense, our own anti-Blackness,
and baggage too,
and baggage, our own
trauma.
Baggage, right? We got out, and I'm not trying to go back, kind of thing. So I just want to bring up that class is definitely a major part of this, and we have to make sure that we are reaching everyone when it comes to this stuff.
Ooh, I love that. That's such a great word to end on. So make sure y'all are bringing these takeaway points to the cookout, to your family reunion, to the barbershop and beauty salon, to the, fellowship hall after your church services, to the street corners where you see folks playing dominoes and spades, or, we call it bones where I'm from, but, whatever you do. Sometimes one of my favorite places to do voter registration is outside in front of the courthouse. Go out to the front of the courthouse, pass out information about getting tested and screened every 3 to 6 months for HIV and other sexually transmitted diseases or infections, and also for a whole host of other health disorders as well. Know your family history, talk to your family. about health. We also are in deep partnership with the American Cancer Society. And one of the things that we've learned in being a part of the national stakeholder groups for African American organizations, civil rights groups, has been that we just don't talk about health openly.
Yeah.
There's so much kind of shame, or not even just shame, secrecy when it comes to our health. And we can't learn from each other as long as we stigmatize and keep secret the day-to-day challenges that we're going through. It doesn't make you a lesser person because of a health challenge that you're managing.
Absolutely.
In some ways, I woke up this morning feeling like Superwoman because I was like, man, my whole body hurts. I'm exhausted. I got my calendar is booked from the start to the end of the day, and I'm still moving through this shit. I feel like Superwoman today because it's going to get done despite it, right?
And I have a nap too.
Yeah, I get that nap somewhere in there. Our nap ministry, right?
Absolutely.
So, that's how we help to destigmatize it, by talking about all of our health, right? So, thank you so much for being with me.
Thank you for having me.
This has been such a fulfilling conversation. I hope those of you watching have enjoyed it. And if you have, please share it. Make sure these gems get dropped with other folks in your community. Please keep your eyes on at NBJC on the Move and our website, www.nbjc.org.
All right. Thank you.
Thank you.